Hello, thank you to Sages and to the moderators for the opportunity to speak with you all today. We have no disclosures to report relevant to this work. A critical part of the preoperative evaluation of patients wishing to undergo bariatric surgery includes the evaluation of mental health comorbidities and substance use disorders. There's ample literature to support this practice, and evidence-based pathways exist in the preoperative setting for performing these assessments. However, there are limited guideline-directed approaches for the long-term follow-up of bariatric surgery patients after surgery, specifically in the realm of mental health. The purpose of this study was therefore to evaluate the scope of post-operative mental health and substance use treatment utilization at the population level among bariatric surgery patients. For this study, we utilized the MarketScan commercial health insurance database and analyzed claims of all bariatric surgery patients from 2011 to 2019. We excluded patients who are under the age of 18 and those who entered the database in 2020 due to possible confounding effects of the COVID-19 pandemic. We also excluded any patient who didn't have a diagnosis code in their records for obesity. Data from over 210,000 patients was included in our analysis. Specifically, we looked at patterns of mental health service utilization over 3 specific time points. The first, which we defined as pre-surgery, was from their database entry until 6 months prior to surgery. Next, we had our peri-surgery period, which was defined as 6 months before surgery until 12 months after surgery. And post-surgery, which was defined as 12 months after surgery until the end of enrollment or 2020, whichever came first. Utilization rates were standardized by time, and a multivariable regression model was used to test for differences in utilization patterns. The 4 categories of mental health services that we examined for this study were community mental health visits, inpatient psychiatric services, psychiatric medication prescriptions, and substance use treatment. This table shows the utilization rates that we identified for mental health services across the 4 categories and within each of the 3 time periods. For community mental health visits, psychiatric medication prescriptions, and inpatient psychiatric services, there were no statistically significant differences identified across the 3 time periods that we looked at. However, for substance use treatment, there was an increased rate of utilization in the peri-surgery period and a significantly increased rate of utilization in the post-surgery period. We also examined the incident rate ratio, putting those peri-surgery period and the post-surgery period, comparing that relative to the pre-surgery data. For peri-surgery, we again found that there was an increased rate of utilization, and in the post-surgery, our rate was approximately 4-fold increase that of the pre-surgery period for substance use treatment utilization. This graph demonstrates substance use encounters by month relative to the date of surgery, with 0 representing the time of surgery on the x-axis. The gray shaded box represents our peri-surgery period, and the unshaded regions to the left and right, respectively, demonstrate the pre- and post-surgery periods. The line on this graph is a smoothed average of encounters per 1,000 person months. This graph shows that the increase in substance use treatment encounters actually begins towards the end of the peri-surgery period and continues to dramatically increase throughout the post-surgery period as well. In conclusion, our study demonstrates that substance use treatment utilization significantly increased following bariatric surgery based on these health insurance claims data, while other categories of mental health services utilization did not change. This suggests that bariatric surgery patients may be at an increased risk for developing new substance use disorders after bariatric surgery. Based on our findings, we believe that the development of care pathways and early identification of effective management of substance use disorders in post-bariatric surgery patients is needed and an important area for further investigation. I would like to thank my co-authors for all their help on this project, and thank you all for listening. Love to take any questions.